Our next speaker is Heather Shelley. Heather is a registered nurse and a licensed midwife in Utah. She has 4 children born in the hospital, birth centers, and at home. She has helped women safely deliver their babies in the USA, Indonesia, the Dominican Republic, and Haiti. She was in Haiti during the cholera outbreak of 2010. Heather helps with emergency childbirth training for the Lehigh and Provo fire departments. She owns a birth center in Lehigh, Utah, and was the first licensed birth center, which was the first licensed birth center in the state. She's an advocate for women furthering their choices in birth, and she is just awesome. So Heather, where did you go? Welcome, Heather Shelley. Oh, there you are.
I have loved being here today. It's just affirmed so many of the things that I believe myself. So today I'm going to challenge a lot of you on what you believe about birth. Oh, put the mic closer, sorry. Sorry, guys. Today I'm going to challenge a lot of you on what you believe about birth, because in the United States, about 96% of babies are born in the hospital. And 2020 was supposed to be a different year for me, and not this kind of different. I was changing from a midwife after 13 years, I guess, as a midwife, to, and 20 years attending births, to being a full-time nurse. And April was going to be my break. I was going to go to Japan, teach some classes. I was going to go to Mexico and relax. I had no birth scheduled that month. It was going to be awesome. And then coronavirus craziness hit, and people started calling me. Some of them didn't want to give birth in the hospital because they were afraid of the coronavirus and going where they felt it was. And some called me because their mother could no longer be with them, their sister, in some cases their husband couldn't even be with them. They didn't want the risk of their baby being taken away from them and separated. So instead of winding down my practice and ending in July, I ended up ramping up my practice. And so Kristen came to me and said, can you talk about out-of-hospital birth? So can I ask who here has given birth outside the hospital, either at home or a birth center? Oh, that's awesome, you guys. That is fantastic. I had my first 2 babies in the hospital. I tried to have 2 epidurals. They didn't work. And I said, if you can't have an epidural, what is the point of giving birth in a hospital? So I had my 3rd baby in a birth center, and it was a water birth. Loved it. Quizzed the midwives to death, asking them a million questions about what if something went wrong. And then my 4th baby, it was a 45-minute drive to the birth center, and I had an hour-and-a-half labor the birth before, so I had that baby at home because I was not spending literally half my labor in the car. So I've experienced that whole gamut myself personally. So let's talk about some out-of-hospital births here. All right, this is mainly towards Utah. It does relate towards other states in the country, but I'm going to focus this because we're in Utah right now, for Utah. So there are essentially 2 types of midwives in the United States. There are certified nurse midwives, and there are direct entry midwives. Direct entry means we went straight into midwifery. We didn't go into nursing first. There's also 2 separate certifying bodies, the ACNM, which is for certified nurse midwives, and NARM, the North American Registry of Midwives, and that is where direct entry midwives, or anybody can go through NARM, but typically direct entry midwives. So CNMs usually get a bachelor's degree in nursing, then they get accepted to graduate school where they get a master's degree, and they can go higher to a doctorate, but at least a master's degree in midwifery, and then they take their certifying exam with ACNM. Direct entry midwives can go 2 different routes. They can do straight apprenticeship and self-study, and then they can apply to take the NARM, what we call the NARM, or they can go to school with apprenticeship, and then they can apply to take the NARM. And you'll understand why this is important in a little bit, okay? So we have certified nurse midwives in Utah. They can work in the hospital, they can work at home. do home births, and they can do birth center births. They can write prescriptions. In Utah, they are not under the dictates of a doctor unless they are writing some pretty powerful prescriptions. Your standard prescriptions, they can stand on their own license. If they're going to do something like OxyContin, which I really hope a certified nurse midwife isn't writing OxyContin, then, or cancer meds, once again, really hope they're not doing that, then they would need to be under the supervision of an MD or a DO. But their scope of practice is the largest. A licensed direct entry midwife, that's what they're called in Utah. Different states, they may be called registered midwife or a licensed midwife, but Utah, it's licensed direct entry midwife. They can carry some basic medications, Pitocin for hemorrhages, lidocaine for suturing, vitamin K eye ointment, some basic medications for births. And they must be a CPM in order to apply for Utah licensure. There are many, 85% of the midwives in Utah, last statistic I had, were not licensed midwives. So only 15% were licensed or certified nurse midwives. So CPM, we kind of talked about, certified professional midwife, that comes with NARM. And then the last one is no credentials. Basically, anyone in Utah can call themselves a midwife. And there are a lot of women that call themselves midwives. So be aware of that when you are choosing a care provider because you've decided to have a baby outside the hospital. Are there any questions on that real quick? I know it's a quick synopsis and it can be a bit confusing. Yeah?
What would you personally choose if you were going to have a midwife? Person on certification.
Right. So you want it. We're going to talk a little bit more about that, choosing what do you want, because it can make the big difference. I've known some certified nurse midwives that there's no way I would birth with them. No way. And I've had other ones that weren't licensed that were absolutely phenomenal. So you do have to look at a larger picture. And in Utah, we do have that choice. We are now the only state in the country that has the choice. Oregon did, but they took that away about 5 years ago. So, okay, so in the hospital, you have doctors and certified nurse midwives, because where are you going to birth? All medications basically are available to you. C-sections, blood transfusions, VBAC, that's vaginal birth after cesarean. Not all hospitals offer that. The small little rural hospitals, Fillmore, Delta, Sanpete, those, Heber City, they typically don't offer VBACs. No water birth unless I think IMC does them now. The U of U did, and now IMC is doing them. And you're definitely not going to get a home visit. Birth centers are CNMs, licensed midwives and unlicensed midwives. A few of them have laughing gas. We were the first in the state to have laughing gas. It's been used for well over 150 years, probably a lot longer than that. Depends on your providers. What medications you're going to have are going to depend on your provider. They can do VBACs, water birth, and most places that do home or birth centers will do a home visit after the baby is born. So they send you home, and the next day they visit you at home as well and help with breastfeeding and all of that. Home birth, CNMs, unlicensed midwives. Now, doctors can do home visits, and doctors can do home births. I don't know of any doctors that do home births in the state of Utah. So I know some in Pennsylvania. I know one in California, and I'm sure there are a few other places here, but I don't know of any in Utah. So, and the same sort of things. Home birth and birth center are very similar on who attends those births. Any questions on that part, guys? Okay, so certifications and training. This is something to look for. NRP, this is different from CPR, you guys. This is neonatal resuscitation program. I don't know why they put P there, but NRP is what it's called, and it is a little bit different of a count than CPR. The reason babies stop breathing is different than why you would stop breathing. So you really want somebody who is current in their NRP training. CPR, that's just kind of a given, right? We want that. Fetal monitoring, understanding what is normal for fetal heart tones. You want someone that really, truly understands this. And to get the certification isn't that hard. Have they gone through the effort to get a certification? That's not that hard. These are good questions to ask for out of hospital. Do they have official shoulder dystocia training, or have they just seen a couple shoulder dystocias and helped out? Newborn complications training and hemorrhage training. These really make a difference. Okay, then you have to ask yourself, how far are you from the hospital? How far are you by car? Is it a 45-minute drive, an hour and a half drive? I remember doing a birth out by Moab on a Saturday night at like 3 o'clock in the morning. There's nothing there, you guys. Okay, this is like Ephraim, I believe, is where I was. There's just nothing on a Saturday night at 3 o'clock in the morning. And make sure that you're where you can get more advanced care if it is needed. What hospital is in network? There's nothing like a massive bill for your clients if they do have a transport, a $10,000, $20,000 bill because you went to the wrong hospital. What level of care do they provide? This is a big one. Did you know that I can do births that Delta Hospital can't do? They can't do VBACs. They can do them, like literally they can. But the rules forbid them from doing VBACs. If there is time to transport to a hospital in Utah County, they cannot do the VBAC. They can't do twins, and they can't do anything less than 37 weeks. Now, you don't want to do them too much less than that, but I can do births that they can't do because their hands are tied. And so looking at what can the hospital in the area that you're at do. They don't have a NICU. They have a little nursery that we call them hucks, that a huck covers, and that's about it. Do they have in-house anesthesia or on-call anesthesia? In other words, is anesthesia going to be there the whole time? We have this myth that the medical community has done that if you need a C-section, we can run you down the hall and we can get you a C-section. That is not reality, you guys. It's not. It takes 15 to 20 minutes to prep for a C-section because they have to call the doctor in. Did you know that your doctor doesn't hang out while you're in the hospital? How many of you knew that? Right? He doesn't hang out. It's the nurses that do. And so if there's an emergency, the nurse's hands are tied because she can't do certain things. No matter what, without losing her license, she can't do certain things. Where when you choose a midwife, the midwife is there the whole time, and she can do those things. That's why the UK and New Zealand, as two countries, that's why they don't have labor and delivery nurses. They're all staffed by midwives, and there's usually 1 or 2 OBs that round the floor, depending on the size of the hospital, because if there's an emergency, the midwives are qualified to handle it until a doctor can get there if that level of care is needed. So a lot of things that we don't know. Anesthesia doesn't, in the bigger hospitals, anesthesia is in-house. But in the smaller hospitals, anesthesia is at home, and they usually have 15 to 30 minutes to get to when they're called. That's the protocol. And so there's this illusion that the hospital is safer because they can do things faster, and they can't always. Now, if you're at the U of U, they can respond a lot faster than the smaller hospitals because they have people in-house all the time. But your average hospital doesn't have them in-house. Okay, what is their attitude on transports? I can't tell you how many times I have called one hospital and another hospital and another hospital until I found a doctor who won't be hostile towards my client or my patient. Because the last thing that woman wants is to walk into a hostile situation because they know that most likely she's not going to vaccinate her baby. And so there's your strike right there against her. And a lot of other things that they have this illusion that they don't do. I called the hospital last week and was talking to a nurse, and she said, "Do you do fetal monitoring?" Can I tell you, I had to bite my tongue to not say we're not barbarians. Yeah, I do fetal monitoring. Seriously? And I did. I shut my mouth. My mom and my sister would be very proud of me because they know I don't do that very often. Okay, so what do you want available to you in births? Okay, do you want certain medications there? It doesn't mean you have to have them, but do you want them available? Do you want Pitocin, Methergin, Misoprostol? These are hemorrhage medications. Do you want vitamin K or an eye ointment for the baby? And it doesn't have to be the injectable, okay? You don't have to do that. Do you want medication for nausea, infections, antibiotics, and labs? Do you want IVs for dehydration, hemorrhage, and low blood pressure? Maybe you do, maybe you don't. The question is, if you want these things, you have to choose a care provider that can provide them, okay? If you don't care about those things, then that's going to open up who you can choose from. So what risks you out? Oops, sorry guys. What risks you out? Well, I'm going to give you two sides of this story, okay? There's the things that the medical world tells you risks you out, and then I'll tell you what's really happening, okay? So they're going to say that a VBAC is too dangerous to have outside the hospital, twins are too dangerous, breaches are too dangerous, and then there's pregnancy-induced hypertension. I just want to tell you a story about that. Robin, are you here? Okay, here's my story for Robin, okay? I had a mom who had pregnancy-induced hypertension, and I transferred her to the hospital midwives, and they said, we're going to have to transfer her to the doctor. This is years ago. And she said, what can I do? And I said, you need to do green smoothies. That's all you need to do, like green smoothies, not kidding you. And she says, I have a Blendtec, I can do that. I can do green smoothies. And a few months later, the C&Ms called me up and they said, we're transferring her back to your care. We have never had this happen. And green smoothies brought down her blood pressure, which also goes to the last speaker. How many bowel movements a day are you having? We ask that question a lot because you've got to get the toxins out. You've got to cleanse the liver. And if you don't do those things, guys, then you're going to risk out and you will have to have your baby in the hospital. You have to be healthy. You have to have a good body. I don't tell women how to eat. I tell them how they can eat, and it is their choice if they stay in my care or not by what they eat. So what things risk you out? I know a handful of midwives in Utah that are phenomenal at breaches and twins, VBACs, and many other things that the medical world would consider too risky because they don't know how to handle. If a doctor can't handle a breach because he wasn't trained, because in 2000 they did the Hannah study that, oh my gosh, breaches will all die, and there's this big rate, and that goes into a whole other discussion about how studies are so flawed and so biased, then how could a lowly midwife know how to deliver a breach safely? You really have to look at that, the training, and the training is going to be in their heads. If I can't do it, you can't do it. There's no way. So if you have a breach and you want to deliver outside the hospital, find someone who knows how to deliver that breach without a C-section. Okay, so are you thinking of trying it by yourself? I'm going to be honest, I don't think that's the best idea, because here's the thing, we were made to have babies, but we have so many things in our environment that we didn't have 50 years ago, 100 years ago. Per this symposium we have, or this protest, we have vaccines that are messing with our genetic pool. We have GMOs that are messing with our genetic pool. We have pollution in our air, in our water, in our foods that are messing with our genetics. Things that they told me I would see once in my career, I see once or twice a year now because our genetics are being messed up. We have got to clean up our genetics, or we're, as Andy said, we're on a downward slope. We're not going to be able to continue to reproduce. So I'm not too much about doing it by yourself, but sometimes that happens, and sometimes you don't have a choice. So I did bring a bunch of things on the table here to look at. This isn't everything. This is just kind of some of the items. Feel free to ask me questions about them. I'll be here at the very end. I'll wait a few minutes before I pack it up and you guys can ask some questions. But in his hands birth supply is where I get the majority of my stuff. And for those of you that have your food storage or 72-hour kits, this is some good stuff to have in your kits, okay? Make your birth kit. I do plastic shower curtains from the dollar store or drop cloths from like Home Depot, Lowe's, that kind of thing. In his hands does have pre-sterilized instruments. They're just not on the website. You have to call them or email them and ask them. And they're, last I knew, they were like $7 a piece. Pretty good price. And you can just throw them in your kit and leave them there. And there's no such thing as too many Chex pads. Do you guys know what a Chex pad is? It's the green or blue or pink or peach pads that you absorb everything and then you throw them away. Love them. Okay, never too many of those. Sorry, I'm trying to look here. Okay, books. I wanted to give you guys some really good books that you could go through that are easy. They're not big scientific. They're quite easy to get through. Heart and Hands by Elizabeth Davis is a very simple book to read. Very, very good. Where Women Have No Doctor. This one is really cool. It tells you how to sterilize with banana leaves, because I know we have a lot of banana leaves here in Utah. But if you needed to, maybe we could use like a grape leaf. I don't know. You never know. But it has some really good information. There is the Homeopathy by Midwives, Wise Woman Herbal, Where There Is No Dentist, and Where There Is No Doctor as well. These are some really, really good books. You can get them all off of Amazon. Like I said, very easy to read. And I bring this up too because I work in a hospital, and let me tell you, nursing school was awesome. I basically shut my mouth through labor and delivery. I got an A-, and I studied 4 hours, and that was worth it to me. It wasn't worth it to get the A to study more. And we did have, I remember once I had to do a very short 2-minute presentation on Guillain-Barré. And I stood up and said, the flu shot, one of the major side effects is Guillain-Barré. And we had a student that got Guillain-Barré from the flu shot. And my teacher was so good, she just kind of did this. And she always let me talk. And I just went against the grain a lot. And I got an A- because I refused to answer the test questions correctly that went with vaccines. And she said, Heather, you're not going to get as good a grade if you don't answer the questions the way the textbook wants you to. And I just said, I can't. I just can't give a hepatitis B shot to a pregnant woman. I'm sorry. It's not going to happen, even if it's in a question. So nursing school was interesting. And then being in a hospital right now. Can I tell you guys, a little off topic, I know, I'm sorry. But did you know that if you're in a car accident and you come in unconscious, they will give you an order for a Tdap. They will not ask you. I've seen it. They give you the Tdap, and the only way you know you got that Tdap is by requesting your records. So little tattoos right here that say no vaccinations might be a good idea, okay? Because they'll give you the Tdap. No, like I said, they won't ask. You're unconscious, and it's ordered. So be aware of those things, guys. I've seen a lot of things that I just, not very fun. What classes should you take if you decide to do it by yourself, or you think there might be a possibility? Do any of you know Dr. Sears? Okay, well, there's a few Dr. Sears. There was the Dr. Sears, and then he had many children, and 2 of those children became doctors themselves. And one of them continued his legacy, okay? And he wrote a lot of books, amazing books. But the first Dr. Sears, he was past medical school. He was doing his residency, and he was, I don't remember where, somewhere in the South. And his wife had very fast deliveries. And the doctor said, you're never going to make it to me. you're going to have to learn to deliver this baby. And he's like, I'm a pediatrician. And he goes, oh, that's so nice. You're going to have to learn how to deliver this baby because your wife's never going to make it to me. And that's how he got into home births, was the first Dr. Sears, by doing that. And sometimes you're going to be in that situation too. So NRP classes, there are 2 women that I know of, NICU nurses, that travel around, and they will teach NRP classes in anybody's home. And they usually charge about $45 is all. So if anyone wants their names, let me know afterwards and I can get them. CPR, herbal classes. When I moved back to Utah, I'd been gone a while, and I was just starting as a midwife, and I found the unlicensed midwives because I knew they couldn't use medications, or at least they shouldn't use medications. And I said, if I want to know how to stop a hemorrhage with herbs, I want to know what to do. A homeopathic for a baby is not nux vomitus, sorry. Carbovegetalis, think you're a vegetable. Carbovegetalis for a baby, and antimonium tart for wet lungs. And we use those for babies, so those are 2 good ones for you. Okay, Carbovegetalis and antimonium tart. And we crush them up and we put them in together, and then we just put a little in the baby's cheek if they need a little bit of kind of a pick-me-up start. But herbal classes, shepherd's purse is really good for stopping a hemorrhage. Amy, what else? What? Cotton root, yep. Yarrow is very good. I buy mine from Sunstone Formulas. I make my own shepherd's purse when my sister had her farm, but she doesn't have the farm anymore, so I have to go find my shepherd's purse. But Sunstone Formulas, it's in Pleasant Grove, and they have wonderful childbirth herbs that you can use. The thing with herbs compared to medications is we may give a dose of Pitocin or a dose of Methergin. With herbs, you have to look at the age of the herb, the weight of the mother, and you have to give more, and you have to keep redosing. Did you guys know that? How many of you know that? Herbs isn't just a one-time thing. You have to keep going. You know how the bottle says 2 capsules a day? Or 2 capsules 3 times a day. When you're constipated, that's not going to work. You're going to be using 10 to 20 capsules of Dr. Christopher's lower bowel formula a day. Okay, so herbs you need to learn more about and get out of that mentality that I take a pill and I'm done. It is, you have to look at your body and your circumstance with this, okay? Emergency childbirth classes. I used to travel and teach emergency childbirth classes to people. Doesn't qualify you to be a midwife or to be a doctor, okay? But they are wonderful to have that knowledge in case you are catching your neighbor's baby because there's an earthquake, or she's just not going to make it to wherever she needs to be. Okay. Okay, one thing about out-of-hospital births is you never have to worry about somebody giving your baby the hepatitis B shot. Because I don't know a single midwife in this state that gives the hepatitis B shot out of hospital. So that is a really nice thing. Your baby never leaves your side. So you know exactly what happens with that baby. Never, ever leaves your side. You can use herbs and homeopathy and essential oils, where in the hospital, they are essentially forbidden from using those things because there's the training and the FDA clearance and everything that would need to be done is too expensive. The drug companies have already paid for that, so it's just easier to use the drugs. Yes?
Now, I'd just like to say that my daughter's, her boy's 8 years old now, and she signed the paper, absolutely no Hep B shot. The doctor came in the room, argued with her, she argued back, eloquently, and he said, well, I guess there's no point in arguing with you. He left, went in there, and gave that to me.
And that, can I say, that happened to my sister. She said no hepatitis B shot. She went to sleep. They came in, they took the baby, gave it hepatitis B, and brought the baby back. I've known nurses that said, no baby under my watch will leave this hospital without getting hepatitis B. I don't care what the mom says. Yeah, there's none. There's none.
We should have a show of hands of how many people that's happened to. My 13-year-old, my
Yeah.
last baby in the hospital for that reason.
Yeah, yes.
System of recording things like that. Like I work for the airlines, and we have what's a self-reporting that we can report anything we see, and goes to NASA. So it goes to a third party and is evaluated so that the airlines and the people will not be held accountable, or yeah. Is there anything like that for hospitals or medicine?
I couldn't answer 100%, but most likely you would have to complain against their license, and not much should be done because vaccinations are the standard of care. And so it's like, oh, yeah, sorry. So I highly doubt a whole lot would be done at all because it's considered standard of care, and so whatever. You might be able to get them for malicious intent. That you could, or integrity, like, right. You might be able, if you really pushed it, to get that, but you couldn't get them for medical malpractice or anything like that, as far as I know. Yeah. Yes?
I have two questions.
Yeah.
One was, have you had any success with these births with mugwort and mugwort oxytocin?
I've tried it many times and I haven't had success with it. Doesn't mean I won't keep trying. Because mugwort and the moxibustion are very much like homeopathics. You have to use the right remedy. And sometimes you, like if you're throwing up, do you need nux vomita? Do you need, my mind just totally went blank, but there's like 3 different remedies for throwing up. Which one is right for you? And so I've used acupuncture for it on spleen 6, and gentle coaxing of babies, and sometimes it's an emotional thing, sometimes it's a cord around the neck. The baby just physically can't move. I say try everything until you find something, because it's not going to hurt. That's the nice thing about the homeopathics, or things like the homeopathics, the Bach flowers, the rescue remedies, is typically they won't hurt. You just keep going until you find the remedy that your body says that's the one I need, and it accepts it. Yeah.
My second question.
Yeah.
At least here in Utah, have the hospitals changed their policy during COVID to isolate mothers from the babies? No, they haven't.
No, if mom tests COVID positive or baby does, they will separate them.
Or if mom has any symptoms. If mom has any symptoms.
But they're separated. They will bring her in for breastfeeding. They'll bring baby in for breastfeeding. Okay, that's new then, and it might depend on the hospital chain as well. So it does depend on the hospital. If you're an IHC hospital, if you're a Mountain Star hospital, those things are going to make a difference. Yeah.
Sorry, I'm having an emotional reaction to this slide.
Oh.
Because
okay.
I just want to say, like, the main thing that needs to be said here is that birth is not unsafe. And the main thing that people need is the empowerment to know that God established birth, right, and women's bodies do it well. And fear is the biggest thing working against us. So this idea that birth is unsafe and we need experts to fix everything what God established is wrong. We have an amazing ability to tap into our inspiration, to know the positions we need to be in, to know what we need to do, what we need to be done, what needs to happen is women need to be taught to tap into that again and to trust it again. And in a few occasions, they might be inspired, but they need to get some additional help. But start from the place that birth is safe. We don't need to be afraid of birth, and so all of the grandparents empower your daughters and daughters-in-law to know that they are the birthing experts. So I'm sorry.
No, and you know what though? But those are the people that birthed with Twilight. That birthed with Twilight. Our grandparents, my grandparents birthed with Twilight. Birth was not safe then. It's ether. They birth with twilight. So they are not the ones to tell their daughters and their granddaughters that birth is safe. It is us. It is us. Because birth, here's what, when people come in and they interview me, I won't take somebody that hasn't done a meet and greet with me first. I say, most of the time, you can go in a corner and have your baby and everything will be perfectly fine. Everything is going to work out great. You're hiring me not because of my price, not because of some fluffy reason. I mean, it's great if we get along. I prefer not to do anyone's birth. In fact, I won't do a birth of somebody that I don't get along with because there's a trust level there. But you're hiring me for when the meconium hits the fan. Okay? That's why you're there, because otherwise, I'm in the other room. I let you and your husband, or you and your husband, your doula, your mom, who's there, I let you guys do the thing, and then I come in, and I just kind of make sure everything goes okay. I don't come in and say, we're going to do this now, we're going to do this now. In the hospital, this one particular hospital that I'm at, the older nurses are all retiring this year, and the new wave of nurses are coming in. And the new nurses are terrified of birth. And I think that is so sad. And they don't like birth. A lot of them don't like it, but they have to do it. They have to work that department because we work all departments. It's a little tiny hospital, so we work everything. And I thought, how sad that a woman comes in labor and she gets a nurse that really doesn't like labor and delivery at all and is terrified of labor and delivery. That is a really sad thing. Don't be afraid of birth. That's why some of us should do it and some of us shouldn't. Looking at it. I was going to say something. I'm so sorry that you.
I'm sorry.
No, it's okay. But look at the experience of the midwife. I had someone that moved to Idaho, and she said she's had shoulder dystocia with every single one of her babies. And I said, find a midwife who doesn't fear shoulder dystocia, because shoulder dystocia can be very scary, but you need someone that isn't fearful of it. That doesn't mean, I'm not talking the blind no fear, but they have confidence and they know what to do. And she did. She asked all the midwives she interviewed how they felt about shoulder dystocia to find one that wasn't afraid of it. Back to your question over there. What kind of midwife would I choose? I would not choose on her licenses. I would look, or lack thereof. I would choose on what I want in birth. When I was pregnant with my fourth baby, we were in Texas at the time, and I called all the midwives, and I found who would do water births and who wouldn't. And those that wouldn't do a water birth, I was like, I'm sure you're very sweet. You're out. Because I wanted the ones, that's the only way I wanted to give birth again, was in the water. And then I asked other questions on what they did to decide if they were in or out. And then when I narrowed it down, then I wanted to look at their qualifications and what their experience level was and what their certifications were as well. If you want medications available to you just in case, if you know you hemorrhage every single time, you can still have an out-of-hospital birth. And that reminded me what I was going to say. Okay, now I totally forgot it. You guys, you're killing me here. You're killing me. I'm going to interrupt myself when I say it again. But you have to know what you want and find somebody that can give it to you, and then you have to decide if you want it legally. Remember, 85% of the midwives in Utah are not licensed, and I will say the vast majority of them do use medications illegally. Some people that does bother, some people it doesn't. And you have to decide if that bothers you or not, that they're using them illegally. And you have to decide where you're going. What can you do to your body? If you hemorrhage every time, there's so much you can do to change that. There's things that you can do. We give shepherd's purse a dose every hour, and then every half hour, and then every 15 minutes to reduce it. Okay, I remembered. I have so many people that come to me and say, oh, that's really sweet, but my grandbaby would have died, or I would have died, or my baby would have died. And I say, tell me the story of what happened. The vast majority of time, it's one of two things. Either the hospital caused the problem. They induced, they were impatient, they augmented labor. Doctor, oh, I almost bled to death. Did the doctor pull in the cord? Yeah, it came right out. Yeah, it's like ripping a scar off compared to letting that scab off rather than letting it come off naturally. I guarantee most of the time the hospital caused the problem. The second thing is I go, oh, that's nice. What did they do for the hemorrhage? Well, they used Pitocin. Yeah, I have Pitocin. Well, I had to have an IV. That's nice, I have IVs. Well, my baby turned breech. How many breeches has your doctor delivered vaginally? Oh, he hasn't. He said no. And I'm like, really? Because I have. And they're all here today, quite healthy. So look at it's that illusion that vaccines are safe or that only you have reactions because that's your genetic pool, not mine. It's that illusion, and you have to educate yourself because most of the time, remember, I'm sorry, they caused the problem. I've seen it. Or it is something that the midwife can handle. Yeah.
Okay, my biggest fear, because my third was born with pulmonary stenosis, with repeat babies, and how that situation.
If it's something that is caught on ultrasound, not all of them are. You know what I tell people? I'm going to be honest. You follow your instincts. And babies speak to us. They really do. I can tell you story after story where, and I don't know how to say it any other way, you guys, but babies speak to us. When we have a labor that is going nowhere, I'll have midwife friends who will push it and push it and push it. And I'm like, this baby's telling us something. We need to go in. And I've had a few of those where the baby had a defect that couldn't be caught on ultrasound, especially heart ones. They're a 2-chamber heart, and then they turn to a 4-chamber heart in very simple terms, right? So you can't catch it when it's a 2-chamber heart until it goes to 4-chamber. And the babies will speak to us. And our job meaning as women, as parents, is to listen. So we need to listen to our babies and listen to our instinct. I will never keep a mom outside of the hospital that says, I need to go in. If she looks me in the face and says, I need to go in, we go. Because something is speaking to her. And then I hate it when you get to the hospital and they go, you're so lucky you came in. And I'm like, luck had nothing to do with it. Yes? Amy?
I just wanted to add that just as much as the research on vaccines is messed up, the research on home birth, out-of-hospital birth, breech birth, twin birth, like it's all messed up too.
Absolutely. You know, Denmark has a very high home birth rate. Very, very high. I think it's lower now, but it's still 35%. New Zealand has a pretty good home birth rate, and you can deliver wherever you want it there. Canada's home birth rate is coming up a lot, and the UK's has, theirs is going down, but it's still much higher than ours. And the difference is it's in the United States, the reason we have an extremely low home birth rate is not danger, it's culture. Pure and simple, it's culture. And by home birth, I also mean birth centers, out of hospital, anything not related to a hospital, okay? Yes?
How far along does a woman have to be? I mean, how early can you deliver a baby out of hospital?
You know, we used to be able to do 36-weekers. And then the March of Dimes, okay, we're talking research, right? How things get messed up and manipulated. And then the March of Dimes did a research study because doctors were, 36 weeks is term. There you go. So they did a big research study, and they said, they found that 36-weekers had a higher compromised state than babies that were 37, 38, 39 weeks. And out of that study, they said you can't not induce until 39 weeks without a strong medical reason, and we're going to take 36-weekers away from out-of-hospital licensed personnel. What they didn't factor into that study is those were inductions. That was not a spontaneous. Exactly. I wouldn't never do a 36-weeker outside the hospital that's an induction. I don't even want to do a 37-weeker outside the hospital that's an induction. But a baby that says, I'm ready to come, that is a whole different ballgame than a baby that says, I'm going to force you to come. That's a big difference. Right, and now some women, and that's where you have to look on a case by case, and that's what drives me crazy about the medical model of this, is it's black and white. In their minds, everything is black and white, but in reality, it's not. If I have a woman that's delivered every baby at 42 weeks, and now she goes into labor at 37 weeks, I'm not feeling good with that. Because I'm like, what's happening? That her body is saying, get this baby out now, when she goes to 42. Yeah.
I just want to say something really fast about the fear of a baby with birth defects. So I just had my 12th baby who was born unknown to us without the right side of her heart. And most babies with this condition live less than a week. Wow. And are most often taken from their mothers right at birth and put into immediate open heart surgery. If the surgeries all go well, they have massive surgeries their whole life. Most of them don't make it through.
Right.
Anyway, our baby, we had a full, joyful pregnancy. We had 6.5 weeks with her because she was born in a very relaxed, peaceful, beautiful way that extended her life. And I got to have her the whole time. And so even the fear of birth defects, the hospital can make those things far worse. And when we did take her to the hospitals, when the real horror began. So we have to question all of our fears and assumptions of that is safe, this is not. That's all true.
And looking at what is needed or not, I had a mom whose baby had no kidneys. We knew it from ultrasound, and we had it cleared through perinatology. And they said to her, you can deliver your baby wherever you want because you have to have kidneys to live. And she chose to still deliver with us. We got it all cleared and everything so that I wouldn't be blamed for some crazy death or something. And I actually wasn't there because she went into labor early and I was on vacation. But the midwife and my friend, the midwives and my friend that were there said, it was the most amazing thing because she delivered her baby the way she wanted. She held her baby and she bonded with no interruption, no interference until her baby died, because we knew that was going to happen. And it was so peaceful not having everybody rush around trying to do whatever they could to do to solve a problem that there was no solution for. Yeah?
Do you do delayed cord clamping?
We do. I do it till the cord stops pulsing. Yeah, sometimes that's 5 minutes, sometimes that's 30 minutes. It's not usually longer than 30 minutes. I say the average is about 10. But babies need that blood volume. As baby, real quick, and then we'll... Actually, do we have any more questions? Any more? Okay, yeah.
How far past the due date are you?
I can go to 43 weeks. Up to 43 weeks, yeah.
I just was been hearing about this and researching about like hypnosis that will help you through your pain. Do you know much about that? Do you support it?
I love hypnobabies. Love hypnobabies. Yeah, definitely. I think a lot of birth is mind over matter. A huge, huge part of birth is mind over matter. And when you are stuck in a hospital bed screaming, what does that tension, what does that do physiologically, pathophysiologically to our bodies compared to feeling like you're safe? And what does the hormone cocktail do? It does some amazing things when you feel safe.
I have a question. So I was talking to somebody earlier today or yesterday about birth, and both of my births were without medication or pain medication or anything. And of course, we all fear pain, right? And so you go into it a little fearful. But after the fact, I relived that like a movie in my mind for months. And it was really precious to have the full experience. It's like if you watched a movie of your own life and you turned off the sound, it wouldn't be the full experience.
So they did an experiment with elk, and it's an old movie on VHS, and it's called The Elk and the Epidural. And when they gave the elk an epidural, it would not acknowledge the baby that it had. And we are human, so we acknowledge our babies. But when we get an epidural, and I'm not saying that there isn't a time and a place for them. I have absolutely seen time and a place for an epidural. But when we get them, it interferes with our hormonal cocktail. It really does.
I wondered if other women have mentioned that they replay that just so many times in their mind that it was so frustrating.
Definitely. Yes? Do they what? They do. They just usually don't call it Lamaze as much. They've just kind of tweaked it. Yeah. Anyone else? Any stories? We have like 1 minute. Yeah.
I'll share a little story. I feel like there's several women who are really interested in trying to find a midwife and stuck in this. I've had 8 children at home.
Awesome.
3 different midwives. My first midwife, I did not end up thinking it was a good experience after it was all said and done. So I switched. My second midwife, I had 3 births. Absolutely loved her. Trusted her with my life. Saved my son's life when he was born not breathing. And I would have stayed with her forever. She passed away after my 4th. And then I had 4 more with my last midwife. I think one of the most important things, you know, when you say above all, be safe, what I've told my kids and people I talk to is you really have to be in a place where you feel happy and relaxed and comfortable and safe. Yeah. And if that is at home, then fantastic. If that can't feel that way at home, then maybe home birth is not for you, because that fear is powerful, like we said. It is super powerful.
Well, and it's sometimes, I don't know if I want to say fear exactly, but we have to follow our instincts. We really, really do. Just like choosing the right homeopathic and stuff. I've had people that came to me because they knew that I was the person. And my last thing real quick is I was a brand new midwife, brand new. Okay, so I still had a lot to learn. And this couple came to me and they interviewed me, and then they went and they interviewed a midwife who'd done it for 35 years, and they chose her. And they actually chose one of my other sisters to be their doula. And I said, be careful, because crap's going to happen at their birth. And she said, why? And I said, because they chose that midwife. And that midwife can handle anything that's thrown at her, and I can't. And they told me they felt like they needed to choose her. That means, and you know what? It did. She had a funky birth. She had massive hemorrhage, massive issues. But that midwife could handle it. And as a brand new midwife, I couldn't have handled what was thrown at that. And she followed her intuition and went with it.
Yeah, one of the things that I found is feeling that connection with your wife is super, super important.
It is.
My last midwife, I think, is phenomenal, and I absolutely love her. I think she's a phenomenal midwife, especially for her first time mom. I went to her as a 5th-time mom, and I was like, I know, I got a needle.
I'm just going to have one more question here.
I was going to say, I had my first 2 in the hospital, and of course, I was delivered like her. And my first one stayed vaccinated behind my back, and he stopped eating. Right? My second one, I spent the entire labor arguing with the nurses because they kept trying to tell me to do things I didn't do. But what I love is that my last birth, I didn't have to argue with anyone. I didn't have to work to stop behind my back. I didn't, you know what I mean? And for me, like you said, to be safe, in a hospital I never felt safe because I spent the entire time arguing with the nurse, saying, no, I need to be walking. No, I don't need to be laying on my back with my legs in the air. I need to be walking. I spent the whole time arguing and I didn't feel safe. But out of the hospital, I felt safe because I didn't have to argue. I could just labor.
And that's a huge, once again, a key thing from this is it's not which one's right, which one's wrong. It's which one is right for you. And that's, I hope that it gave you some information today to know and be able to choose and broaden. It's not just a hospital. There are more options available to you, and there are more providers available to you. Now you have the job of finding which one is best for you and your baby. So good luck, you guys.